You may have heard of drug cartels and substance abuse in movies, but the harsh reality is that it's happening right here in Uganda, and it's about to get even more real. The medication-assisted treatment MAT clinic at Butabika Hospital, which has been providing methadone to patients battling with substance use disorders, has reportedly shut down due to a freeze in USAID funding. This sudden closure has left hundreds of patients in distress and unsure about tomorrow.
MAT clinic closed around about 16 days ago. We were 725 to be exact. So that number, some had of course successfully finished the program, while some were still, actually they mostly had from 600 to 725, around about 125 clients were still on very high doses. So when it was abruptly cut, I think most of the services were stopped and people were hurt. Withdrawals were quite hard, and for example, if someone is on 120 mLs, surely, and you cut him immediately, they just cannot continue, in the normal being.
Following the closure of the MAT clinic, rehab centers have had to bear the brunt, receiving an overwhelming influx of patients from across Kampala's suburbs. Grace Bikumbi, a clinical psychologist and the coordinator of the Presidential Initiative on Rehabilitation and Skilling of the Ghetto Youth, runs a rehab center focused on rehabilitating drug addicts.
We had an influx here in the Presidential Initiative where most of these ghetto youth now had to come in here for help. And we make sure that when we bring them in here, we talk to them, they are assessed, they are managed medically, we do detox. We also use treatment by use of the professionals, and also for those who don't need treatment or withdraw, we make sure that we actually do a lot of comprehensive counseling and psychological interventions. For now, we have almost 100 per day that are in here for help. But they don't sleep here, they come during morning and leave in the evening. So we know that they are living a very sober day. They are going through care, and then they are not having thoughts of going back onto streets and going back in ghettos.
There is a big prevalent rate of Class A drug abuse, such as cocaine, heroin, and opioids. But where do these drugs come from? Experts say that Uganda's lenient legal framework and vulnerable border security have created fertile ground for drug traffickers. As a result, the country has increasingly become a center for the production of certain synthetic drugs.
We have very weak border points. We have lax narcotic laws. So some of these cartels are taking advantage. We are more or less on a route to Europe. Some of these drugs are coming from South America, through South Africa to Uganda, then Europe. So they are taking advantage of our systems here. And we also have people from West Africa that are now manufacturing synthetic drugs, especially in areas like Kabalagala, Kansanga. They are very they are hotspots now for drugs.
Drug abuse is continuously seen as a social problem, but it's a growing crisis. It is believed that at least 1 in 5 family members struggle with addiction, whether to drugs or alcohol. Ronah Nahabwe, NTV.